Hey there. My name is Dr. Cozy. It's really nice to meet you. I understand that you're here today so that we can go over an allergy assessment. Okay. First and foremost, can I just have you verify for me your name and date of birth? Perfect. Okay. Sorry, it just took me a second to get my program to load here. So I do have just a few questions for you, okay? So first I see that you've been having some hives and swelling on different occasions while you've been eating food. Do you have any existing known allergies? Oh yeah, that one's common, especially this time of year. Okay. But no food allergies that you're aware of? Yet, okay. Okay. Do you have an idea of any potential foods, any ingredients, anything seasoning-wise, oils that may have been in the food that you were eating? Okay. Were there any particularly consistent types of food? Like, for example, you went out for Italian and it happened, Mexican, Thai? Okay. Okay. Interesting. Is this happening at home as well, or just eating out? Okay, so it happened once at home. Do you remember what it was that you were eating when it happened? Okay, so you ate at home, but it was store-bought food. What was it? Okay. Can you describe for me the reaction or reactions in detail? For example, did you have hives, swelling, and also if so, where on the body did you have a reaction? Okay. When you say that your eyes were they swollen so much that like you couldn't open them? Okay. All times? Did you notice any throat swelling, throat scratchiness at the time? Okay. And have you ever had allergy testing done before? When you were a little kid? Okay, that's a pretty common time for people to have it. Do you remember what the positive tests were? The allergies you told me? Okay. Okay. And then, would you like me to forward your results today to your primary care physician, or would you prefer that I give you a copy? We can do both, absolutely. Then on your way out, you're going to want to stop at the front desk and they're going to have you fill out a release of records form, okay? Which will give us permission to forward your records on as well as release them to you. Yes, we still have to have you sign. That way we can keep track. It's part of the Patient Privacy Act, so we are very, very strict about following it. Okay. So first thing I'm going to do is I have this clip here, and we put all of our equipment that is unable to be autoclaved in Ziploc, so that way we know that they're sanitized. I'm going to clip this on your finger, and it's going to allow me to monitor your oxygen levels as well as your heart rate throughout the testing. Even small variations in heart rate or a drop in your oxygen saturation can be indicative of a reaction. So we like to be extra cautious. Is there a particular, oops, I just rolled over the cord. Is there a particular finger you'd like to use on which side? Okay, so I will say whatever finger we use, we want to use it on the other hand that we will be testing on, the one that we won't be testing on. Okay, that's fine, yeah. Okay. Would you prefer that I tape it, or are you okay with it just clipped? Okay, so let me just... That should start reading for us. And okay. Before we get started with the actual testing, I'm going to do an exam to establish a baseline, so that way, if you do have symptoms, we're able to have a basis of comparison. The serums that we will be administering that contain allergens, for some people it requires a higher concentration to have a really clear reaction. So that's why we do this, just in case the reaction is subtle. Okay, so to start, I'm going to take a look at your skin, okay? And it's going to be a pretty close-up look here. Is it okay with you if I touch you? Thank you. Just because sometimes people do have a little bit of puffiness, especially if they've not been sleeping well. And there's no judgment there, I have it all the time. I just want to make sure we're able to identify it as being that and not an allergic reaction. So I'm going to be pressing lightly. Now I'm going to be feeling with the backs of my hands to check for any hot spots, any temperature fluctuations on the skin. feeling any warm areas or temperature fluctuations. May I just have you close your eyes for me? I'm going to very lightly press on your eyelids. Okay. You can open. Just because eyes are one of the places we tend to see swelling most frequently. Just wanted to make sure if there's any existing swelling, we had it accounted for. Not seeing anything on the skin front. So it's a little bright. I just need to take a look into your eyes and I'll try to be quick, okay? So first, if you can just direct your gaze right here in between my eyebrows. Good. Okay. And if I can just have you look up for me. Can you open your mouth for me, please? Perfect. Just gonna press down on your tongue. Just making sure I don't see any swelling inside of the mouth or airway. Okay. And if you can just lift up your tongue. Beautiful. Good. I'm going to press my hands on the outside of your throat. Right here. And can I have you swallow for me? Good. One more time. Now I'm going to listen to your throat. I'm going to listen to your tummy. Holy moly. We do listen to throats occasionally if we need to check the carotid arteries. Can I maybe take a deep breath in for me? Good. And breathe out. Again, deep breath in. And breathe out. Good. Again. Okay. And again. Yeah, it happens sometimes. I mess up my words. Part of it is due to seeing a high volume of patients, and part of it is it seems that when women arrive at a certain age, we have a little bit of brain fog. I'm going to do is set up a tray and move it in front of you. The hand that does not have the clip, I'm going to have you just rest it on top of the tray, alright? Okay, so let's get set up here. Is this a comfortable position for you? Okay, good. So to start, I just want to take a look at your arm, okay? I just need to make sure that I don't see any existing swelling or rashes that might give us a false positive. Checking your capillary refill. Okay, good. Now what I'm going to do is disinfect the arm. That way, if there's any kind of lotion or oils, I'll know that, it won't interfere with the results. We don't want a reaction to you showing that you're allergic to your skincare products, while still concerning, but we're trying to narrow down food allergies. In which case, a reaction to that wouldn't be very helpful. I'm going to give that just a moment to dry. Right. You doing okay? It's totally okay to be nervous. I know a lot of people have anxiety with needles. I used to before I went to nursing school. We practice on each other quite a lot in med school as well. And so it gets you over that fear pretty quickly. I guess you could call it exposure therapy. Alright, so then just need to find pen. Let's make sure this reads. Yep. So now, let's see. Yeah, we're pretty dry. So I'm going to be labeling some numbers on your wrist here, or I guess your forearm. So that way we're able to easily identify which injection goes where and what, if any, caused the reaction. So I'm going to try not to take too much real estate here. Oh, my 0? Yeah, we're taught to write them like that, so that way, if we're charting by hand, by writing, it's easy to differentiate the difference between a 0 and an O. Helpful little trick. So, okay. I'm gonna start, if that's okay with you. Okay. First, let's get rid of the cap there. So, just be aware, this is only gonna go in the very top layer of skin, so it really shouldn't be very painful. If anything, you'll feel the prick, and then it might just feel like a little bit of pressure. Okay? So I'm gonna start. And let's good. Just trying to see the bore of the needle, which is the little hole in which the medication comes out. You want it facing up. Three. Hanging in there? Good, okay. Like I said, it's natural to be anxious, but that's generally more mental in terms of discomfort than physical. Although this one is in an area where it might be a bit more sensitive. So let's take a deep breath, okay? Good. Breathe out. Good job. I know. But boom. Done. Now we're halfway. So I'm gonna reposition myself just a little so that way I have good leverage. And actually, can I have you bring your arm? Good. Not a huge shift, just a little, okay? So good. There we go. Forget my shaky hand, it's just kind of a weird angle. Okay. Oh, come on. Sometimes, there we go. These are a little persnickety. So now I cannot cover any of this with a bandage, but what I can do is very lightly just tap just to blot up any drips or drops here. That is the most we're able to do. So you did great there. So really quickly, I'm just going to check your eyes and your throat. Let me grab a depressor. So fix your gaze right between my eyes. Good. Okay. And then open for me, please. Brilliant. Okay. Everything looks fine there. I'm going to do a quick listen. And then I'm going to let you rest for just a few moments while we wait for a reaction. So, can you take a deep breath in? Good. And out. And again. Sounding okay there. It's very unlikely that you would have had a reaction already. It's pretty uncommon. But sometimes if the allergy is very severe, we will see things pretty quickly. But for now, we're going to give it a few minutes and see if something turns up. If it does, one of the injection sites will start becoming a bit red, and at which point we will take a measurement of it and record that. Okay. Okay. I'm gonna be typing a couple of notes up. If anything starts to feel not right, you feel short of breath, you develop a sore throat, any kind of visual changes at all, any blurry vision, like stars in your eyes, light streaking, I want to know right away, okay? Any itching, if you start noticing any redness, or anything is just different or doesn't feel right, tell me, okay? Okay. Okay. So, let's take a look at your arm, okay? Alright, let's take a look here. Okay, so let's check. Looks like we see positive reaction to egg whites as well as oysters, which, since you said you'd been eating some Thai food, it makes sense that you might have had some oyster sauce in your diet. So I'm just going to measure these really quickly. Take a look here. All right. Alright, that's that one. Now let's go to number 9. It's almost exactly 1 centimeter. Very close. Alright, so you can go ahead and take your arm back, okay? Okay, so let's get this recorded. We have egg whites and oysters. It's actually really common for people to have an allergy to egg whites over the egg yolk because of the proteins that exist in the egg whites. I actually have that allergy myself, though it's pretty minor in nature. But if I eat enough of them, my body definitely lets me know. So I am going to be prescribing you an EpiPen, okay? For you to use if things get really severe. You'll want to keep it on you at all times. And another thing that's going to be really helpful is, for example, if you go out to eat, research the menu before you go. Sometimes restaurants won't put every single ingredient on the menu, so if there's any doubt and you're not able to find it, definitely encourage you to call ahead, okay? So now what I'm going to do is I'm going to re-examine your skin, okay, and make sure that there's no spread of reaction. Are you feeling any kind of itchiness beyond the arm right now? Okay. Let me know if that changes. I'm going to be pressing again. have you open for me again? Great. Okay. Remove this. Just have you lift up your tongue. Good. So direct your gaze right between my eyebrows. And look up for me. Okay. Actually, real quick, I'm just gonna feel the outside of your throat. Have you swallow? And again. Perfect. Now I'm going to listen to your chest. And to start, just go ahead and breathe normally, okay? So now if I can have you take a deep breath in for me, please. And out. Good. Again, deep breath in. And out. Again. And again. Very good. Heart rate, oxygen saturation are showing unchanged, which is good. How are you feeling? Are you feeling different, uncomfortable, itchy? Anything I didn't mention? A little hungry. Okay, that's fine. But you're not feeling any dizziness, headache, pain? Okay, any difficulty swallowing? Okay. So, then, take off my gloves here and boop them on over. So, like I said, I'm going to prescribe you an EpiPen, and just a second. Okay, so it looks like you have 2 pharmacies listed. I'm going to write you a 90-day prescription with 6 refills. At the end of that time, I want you to come back in and your pharmacy will remind you. But what I'm going to do is I'm going to send the initial prescription to the Safeway that you have listed. That way you're able to pick it up right away. And then because there's a 90-day supply, you'll be able to import it into your mail order without an issue. All right? Okay. If there is an issue, give us a call and one of our medical assistants can call your pharmacy and work that out for you. It's very rare that there's an issue, but never say never. So let's get that taken care of. And then after your follow-up visit, we can transfer this prescription to be under the care of your primary care physician. But I like to do the initial follow-up just so that way if there's any kind of changes, any issues, we're able to address it right away in the full extent required. So the EpiPen is used for something called anaphylaxis, which is an allergic reaction to the degree that your throat swells shut and you're not able to breathe or swallow. You can generally detect this starting if you start feeling like you need to clear your throat a lot. You get that scratchy, tight feeling. As soon as you get that feeling, jab the pen, all right? And the pharmacist will be able to actually sit down with you and show you how to use it. In the case where you start just feeling hives, a little bit of eye swelling, it doesn't seem quite that severe, go ahead and take 2 Benadryl, diphenhydramine, and that should take care of the issue. If it doesn't, give me a call right away or pop into an emergency room or urgent care so we can address it, all right? Sometimes allergic reactions can be sneaky, and something that may start off seeming pretty benign can escalate. So it's always a good idea to make sure you follow up right away. There will be a point where this just becomes second nature because you'll be used to it. But particularly in the beginning, any concerns, doubts, just call, okay? It's important that we address these things right away. So then, make sure that we have your primary care's information. We do. So as soon as I get your signature from the front desk, I will forward your information over, okay? And also they'll be able to give you all of your information once I finish typing it up, once you've signed the release. Okay. Do you have any questions for me? Okay. Well, if you happen to think of any, oh yeah. I would say unless you get to a point where you do experience anaphylaxis or you continue to have a severe reaction where your eyes swell shut, I don't necessarily think that you require a medical alert bracelet. However, it's not a bad idea. And it's really helpful to have, especially if there's a situation where you're not able to speak, to have one. So I do encourage you to look into it and purchase one, but I wouldn't say it's absolutely necessary, but it could be helpful. Okay. We actually don't have a connection to one of those companies, but I'm sure one of the front desk people could probably look something up for you. Okay. Any other questions? Okay. That's it. I'm going to have you stay here for the next 15 minutes, just so that way if anything does happen, we have you in office and we can take care of you right away. After this amount of time, it's very unlikely, but like I said, never say never. So keep that clip on your finger. If something changes, that monitor is going to set off an alarm. If you just start feeling a little funky, there's a little doorbell right there on the wall. Go ahead and push that, okay? And someone will come running right in. Okay. So I'm gonna go talk to my front desk and we'll get you all situated when you're ready.